Hello friends, welcome back to Dr. Jaggi's Academy. So in continuation with the chapter of monoclonal antibody, I will discuss in today's video about the therapeutic uses of monoclonal antibodies. So let's start. So in this video, I will give various examples of monoclonal antibodies which are used clinically for the management of different kind of diseases. So let's start. So first of all, I will discuss about the anti-VEGF antibodies. So what is meaning of this word? Actually, there is a one protein which is called as VEGF. The full form is the V for vascular, E for endothelial, G for growth, F for factor, VEGF. What is the function of this factor? This factor is involved in the genesis of new blood vessels, formation of new blood vessels. That process is called as angiogenesis. So obviously this angiogenesis is very beneficial for the human being, but obviously this is not useful in all the conditions. Okay. So there are certain conditions when this kind of the abnormal VEGF produces some disorders. So in order to overcome those problems, scientists they have developed the antibodies which target these antibodies, which target this protein. So those antibodies they are called as anti-VEGF antibody. So one of the example is the bevacizumab. So if you remember my previous video on the monoclonal antibody, that you can see by clicking on the link which is given in the description section. I told if this ZU is there, ZU stands for the humanized form of the monoclonal antibody. So this is a humanized monoclonal antibody. Second is the ranibizumab. It is again a humanized monoclonal antibody. So there is a fully human antibody, monoclonal antibody is also there, which is the ramucirumab. So now, where these antibodies can be used? One example is the metastatic cancers. Metastatic cancers mean the cancers which are spreading to whole of the body. Metastasis, that means in meaning of metastasis is that let's say cancer is present in the lungs, and if this cancer passes from lungs in let's say into the brain without involving other organs, that means directly from lungs it is jumping, it is going into the brain, this process is called as metastasis. It is not only in the brain, it may also go into the bones, it may go into any other tissue. So that is called as metastasis. So it is identified that the metastasis is ultimately dependent upon the growth of the new blood vessels. So if you overcome this new blood vessel formation process, then metastasis can be reduced. So in keeping that view of the metastatic cancer, so obviously, as I told, growth of the cancer, metastatic cancer is dependent upon the new blood vessel formation. So these kind of antibodies they have been tried and used in different kind of metastatic cancers, like in breast cancers, colorectal cancers, and other kind of the cancers. So second condition, it is called as AMD. What is AMD? A stands for age related. M for macular degeneration, age-related macular degeneration. If you remember the physiology part of the eye, this macular, there is actually a macula portion in the eyes near the retina. Okay, so in that portion, what happens is there is abnormal angiogenesis. New blood vessels are formed in an abnormal manner. So what is abnormality actually? Abnormality is that those blood vessels are more permeable. Permeable means the fluid start leaking from those blood vessels. So because fluid start leaking outside, so there is a you can say more of the fluid, and it creates the vision problem. So this is what I am saying. Increase in VEGF promotes abnormal vascularization in the retina, and which produces the vision problem. So in order to overcome this AMD, these kind of the antibodies they are injected in the eyes, so that this vision problem can be overcome. So this is the first class of the monoclonal antibody. Second class, it is the anti-TNF Alpha antibody. It is very well known that TNF alpha is actually a very important cytokine which is involved in inflammation. And obviously, these antibodies, they bind to this TNF alpha, it is neutralized, inflammation is inhibited, and inflammatory diseases can be reduced. So, I'm just giving the names of some of the anti-TNF alpha antibodies, like adalimumab, it is fully human. Now you can see it is a U for human. So now, certolizumab, humanized, golimumab, fully human, and then infliximab, which is a chimeric antibody. So where these TNF alpha antibodies, they are used. They are used in moderate to severe cases of rheumatoid arthritis, wherever the inflammation is there, like in the psoriasis or in the inflammatory bowel diseases, particularly if the persons are not responding to other drugs. So this is the second class. Coming down to the third class, antibodies, they are developed against the HER2. They are called as anti-HER2 antibody. So what is HER? HER. H stands for human, E for epidermal, and epidermal growth factor. This R is the receptor. So human epidermal growth factor receptor 2 is present on the breast, and it is particularly very important for the proliferation of the breast cancer cells. So antibodies, they are developed that target this protein, and example is the pertuzumab and trastuzumab, and very commonly trastuzumab is called as Herceptin, and obviously you can say they are used in the HER2 positive breast cancer conditions. Now coming down to other kind of antibodies, anti-IL-6. IL-6 is again a very important cytokine which is involved in many type of inflammation. So these antibodies, they inhibit this cytokine. As a result, they inhibit the inflammation. Example, siltuximab, tocilizumab. And where these are used? They are used in moderate to severe cases of rheumatoid arthritis. Now, anti-IL-2 antibodies. IL-2 is again a very important cytokine, and IL-2 is very important in the activation of the immune response. If IL-2 is not there, then helper T cells will not be activated and all the immune system will be suppressed. So if you suppress this IL-2, so you are going to suppress the immune response. Example, basiliximab, daclizumab. But why we want to suppress the immune response? Because whenever the excess immune response is producing the damaging effect, like acute organ transplant rejection. You have transplanted one organ from one person to another person. Second person is not accepting the organ because the immune system is not allowing the acceptance. So if you suppress the immune response, the recipient can accept the organ. So you can prevent the rejection. Now I will go for the individual antibodies. So now this is the epciximab. Epciximab is actually a chimeric monoclonal antibody, and the target is glycoprotein 2b3a receptors. If you remember the pharmacology, this glycoprotein 2b3a receptors are present on the platelets. And what is the function? The function is the platelet aggregation. So that means if you inhibit these receptors, platelets will not be able to aggregate. If platelets are not able to aggregate, so we can prevent the ischemic heart diseases like myocardial infarction or the angina pectoris. Even this drug can be used in the acute attack of the myocardial infarction. Another one, muromonab CD3. So I discussed this monoclonal antibody in my previous video of the monoclonal antibody that you can see by clicking the link in the description section. So this is also called as OKT3, and it acts as an immunosuppressant. And how it acts as immunosuppressant? By binding to CD3 glycoprotein present on the T cells, Once it bind to this CD3, the number of lymphocytes they decrease very quickly. Whole the immune response gets suppressed, and it is used to reverse acute renal allograft rejection. That means when you have transplanted the kidney from one person to another person, in order to avoid the rejection, in order to reverse the rejection, you give this one. But the major problem is that it produces the HEMA response, type 3 hypersensitivity reaction, or the anaphylaxis or shock-like conditions. So that is why the use in the clinics is decreased of this kind of the monoclonal antibody. Another very important monoclonal antibody is the omalizumab. It is a humanized antibody whose target is IgE. And once IgE is inhibited, so the interaction between IgE and mast cell will not take place, and as a result, type 1 hypersensitivity will not take place. So you can say omalizumab inhibits the type 1 hypersensitivity reaction by binding to IgE. Where it is used in the bronchial asthma. Now another one, alemtuzumab, which is also called as Compath 1. It binds to CD52 glycoprotein present on the T cells and the monocytes, and it is used as immunosuppressant to prevent the organ transplant. It is also used in different kind of blood cancers, like in certain leukemias, like lymphocytic leukemia, chronic one, and T cell pro-lymphocytic leukemia. Another one, rituximab. So now it binds to the CD20 protein on the B lymphocytes. As a result, it is used to treat certain cancers like CD20 positive non-Hodgkin lymphoma. Actually, in this video, I am not discussing about these diseases. So these diseases I am discussing in my pathophysiology lectures. I am just mentioning the name of the diseases. So it can also be used, rituximab, to overcome the rheumatoid arthritis when the normal drugs are not working. So in my upcoming video, I will discuss about the hybridoma technology, what is the principle and what is the methodology.